Hey guys, so this is going to be a great video covering topics ranging from the Hillsborough County Board of County Commissioners and specifically the tyrants, why they are total tyrants who don't care what the science says, who don't care what the Florida Department of Health epidemiologists say. Then we're going to move on to the Eastern Virginia Medical School protocol. Their COVID-19 protocol, extremely popular, adopted all around the nation, has been deleted. This PDF document has been deleted. We're going to cover that. We're going to cover attempts to suppress peer-reviewed academic literature that's been published in peer-reviewed journals, specifically this article right here. Then we're going to cover absolutely disturbing news coming out of the United Kingdom. And we're going to look at their technical briefings, and the United Kingdom technical briefings are extremely thorough, the way that they break down data. You're looking at 40, 50-page reports. And then we're going to close off, rounding back to the Board of County Commissions, what happened at the meeting today. So I want to start off with Hillsborough County, which is, of course, where Tampa is located, has an extremely tyrannical, conflicted Board of County Commissioners who don't care what the science says, who don't care what the data says. And so I want to give everyone a breakdown of who the commissioners are and where they stand. And so we have two commissioners who are not for mask mandates. And we have five commissioners, the five that you see in this image here, who are all pro-mandate. Just to give a breakdown here, we have in the middle Commissioner Kim Overman, who is one of the absolute worst. She posted on her own personal Facebook a public statement throwing out the idea of soliciting, actually, companies to donate lanyards that we would then place on unvaccinated children in order to differentiate them from vaccinated children. She is a radical leftist. She is totally and completely corrupt. She does not give any consideration to the people, to the science, to the facts. She has her group of friends who tell her what to do, what to think, and it doesn't matter what the facts are. It doesn't matter what the reality is. That's what she's doing. Then we have to the right of her the chair, Commissioner Patricia Kemp, who is right next to Commissioner Overman in terms of being a corrupt tyrant. She is a total leftist. She's a little bit more intelligent than Commissioner Overman, but she is also someone who does not care what the people say, who does not care what the facts say. She is a radical leftist tyrant. To the right of her, we have Commissioner Mariella Smith, who is just very weak, very, she does what you tell her to do if you're the right person talking to her. If you're the people, she totally ignores you. She doesn't care. She does whatever her advisors and her consultants tell her to do, whatever her friends tell her to do. So that's someone who's corrupt. Don't get a real strong vibe of her being bad-natured like from these two. A lot of people consider Commissioner Overman and Commissioner Kemp to be evil, and they especially apply that word to Commissioner Overman. Commissioner Smith is more just weak and does whatever her powerful friends tell her to do, people that can get her jobs at consulting firms after she leaves the Board of County Commissioners, and whatever her donors would tell her to do, people that she perceives to be in power would tell her to do. Commissioner Cohen, I believe he's an attorney. You can tell he's smart, not dumb, but this is also someone who will do whatever the power brokers say, and absolutely no regard for the people. And again, this isn't someone who is characterized as evil, but this is someone who's smart, who knows what he's doing, and doesn't care what the data say, that said what the data represents, doesn't care about the facts, only cares about what his friends want him to do, what the people with money want him to do. Then we have Commissioner Myers, who is also, there's no one out there characterizing her as evil, but she's just another one who is extremely hesitant to deviate from what her friends, what her power brokers, what her consultants tell her to do. She does not listen to the people. So to get into this, I first want to pull up this video which is from the previous meeting, the one that occurred 3 weeks ago, the last meeting before today. And at that meeting, we had Dr. Holt with the Florida Department of Health. He's actually the director for the Hillsborough County, Florida Department of Health, present a COVID-19 report. And actually, I'll fast forward to today's meeting just to give everyone an idea of what the report looks like. And so the report is essentially this data moved back 3 weeks. They always look at the exact same data, which is 7-day average positivity, the amount of cases recorded per day, the 7-day average, and then they'll look at 7-day average cases per 100,000 residents. Then they'll look at specifically the pediatric college age groups. And then they'll look at the hospital emergency department visits, the COVID inpatient admissions, people who are admitted inpatient, and then the 7-day average. Those are the only numbers that they look at, which are the most sensitive to error and the most unclear numbers in terms of measuring a pandemic. But that's what's usually presented at these reports during the county commission meeting. And then following the report, the doctor will be available on standby for the commissioners to ask him questions. So what we have here is the meeting that occurred 3 weeks ago, and we have Commissioner Kemp asking the presenter, Dr. Holt, a question, and it's very informative.
And our masks, if we can't get vaccinated, children under 12, immunocompromised, our mask is our next best defense. Is that correct? I mean, we've just heard so much misinformation today. Not by you, but earlier in the morning.
Well, beyond that, it really is, it's situational awareness, being, where you are, who you're around, what are your situation. Masks will help in some of those situations. If you're trying to prevent from getting infected, you need a very high quality mask.
All right, we're going to pause right here and just point out, Commissioner Kemp asked, honestly, a very easy yes or no question. If you can't get vaccinated, is masking the next best option? And then she went on to criticize the people who left public comment who actually presented data and scientific facts, and a yes or no question, and Dr. Holt could not provide a yes. He ends up tap dancing his way to, well, you need a high quality mask. What does that mean? What kind of a mask is that? Is that a $50 mask? Is that a medical mask? What does that mean? And he ultimately tap dances his way to, oh, it will help, especially if you're looking to protect others from getting COVID. So at the meeting before that, we had epidemiologist Dr. Weiss, who's with the Florida Department of Health, and we had Commissioner Overman asking the only question about masks that was asked following the presentation.
Excellent, thank you. And your last question, and based on the data that you've seen since we first started dealing with this back in March, and the time periods where we've had high utilization of mask coverage, either in schools, community centers, or in the community, in businesses, do you see a correlation between a drop in COVID positive or hospitalization rates during those time periods where there was a high utilization of masks? And would that actually be an indicator that mask usage, either in adults and or children, would actually assist us in reducing exposures to COVID?
Yeah, I definitely appreciate that question. And we get into a little of a chicken and egg situation with some of this, in that, when we see case counts rising is when we start to implement a variety of mitigation measures, including, we've used closing down businesses and shutting down certain establishments. We've used masking. We've encouraged social distancing. So being able to tease out the impact of each one of those measures becomes pretty challenging. It does seem that the collective effort that was put in during the winter wave and then the summer wave in the past, the collective mitigation measures do have an impact on reducing the transmission moving forward. But it is really difficult to point to one mitigation factor over another.
So again, the doctor with the Department of Health was asked a yes or no question, and he was unable to say yes. And he ultimately concluded by saying, yeah, we can't say if masks reduce exposure to COVID-19 or if masks were responsible for the reduction in numbers that we saw in the past. So with this information, at both of these meetings, there were no more follow-up questions pressing the doctors, and the commissioners decided to stick by their decision to require masks in every single place that they can require masks without getting a harsh, immediate no. And so that's on county properties and in county facilities, and even that is being challenged because, of course, as you can tell by the answers from the doctors with the Department of Health, masking does nothing. They can't show that it does anything to reduce COVID-19 exposure. They can't even say that it'll protect you yourself. So they didn't care about the scientific facts. They wanted to implement mask mandates, and they implemented mask mandates. And so now, just to catch people up, and just so that people can see exactly what's going on during these county commission meetings, because I know everyone's busy, everyone has a life, everyone has work and family and friends, and all sorts of things that we're trying to do. So just to give you a synopsis, this is how the staff report on COVID-19 related data is reported at all of the meetings. They first of all start off with a gentleman that reads out this information. So I guess we can just play a few seconds of this.
Brief update on current COVID operations from the EOC. Testing continues to decrease within the county. Positivity rate of rapid tests of county test sites averaged 13.4% last week. Hillsborough County and the city of Tampa managed testing sites account for around 28% of the testing results within the county. We looked at the pharmacy testing availability, and wait times have improved. Most locations have appointments in 1 to 2 days. We've also found some locations have testing appointments same day. Vaccines are still available at the Lee Davis Community Resource Center. Private providers are currently administering third doses to immunocompromised individuals.
Okay, so what he just said as far as that last part is that they've started booster shots in certain individuals. And what you see here is data that essentially means nothing in terms of measurement of how severe a pandemic is. It's just more of a report on things that they consider important, like testing. You heard him say that testing was down. Now, I've listened to these reports. The report from today says, vaccination is increasing. Not necessarily increasing, but I think it was 10,000 new people per week are getting vaccinated. So the number of vaccinated people in Hillsborough County is increasing. You'd figure the amount of people, therefore, that are getting tested is decreasing. So like he said, testing is decreasing. It's interesting, this measurement of antibody treatments. It's actually probably not a bad thing to keep track of. One thing that is actually really interesting data, really illuminating data that they're not keeping track of or displaying is, of the people receiving antibody treatments, how many of them are vaccinated and how many of them are unvaccinated. That would be interesting. So they go through this data here. Okay. And let's see. Okay. And then we go ahead and get the report from Dr. Holt.
Please. This is the report that we've been presenting, and the top graph shows our.
So this is really interesting, believe it or not. I don't know if it's a coincidence or not, but this little screen right over here, I did not put that there. That's how the video is displayed on YouTube. That's how the video is displayed in the record for anybody who requests a video of this meeting. It's totally covering up a massive decline right here, a massive decline. I don't know if I saved this. Let me see here. I don't think I did. So, okay. So there's I almost feel like pulling it up just to kind of show how disgraceful this is. I don't think they've done this during previous meetings where I mean, this little screen right here just happens to be covering up a massive decrease, which let me show you guys how to pull this report without actually attending the meeting. So if you and you can do this even before they give the report. So you look up Hillsborough County Board of County Commissioners. Okay, we'll click right here, and we will go to board meeting agendas and minutes, and we will go to regular meeting agendas, and September 22nd, here's the agenda right here. We just got to click this icon, and we're going to scroll down, and item G2 right here, receive a report on local pandemic related data. Okay, click. And here we have the report. And I could tell they changed it on the day of the meeting or very close to the meeting. I guess additional information was submitted by the Department of Health. Okay. So what are they covering up here? They're covering this up. They're covering this huge, look at this huge decrease right here. This is insane. This is what they're covering up with their placement of the miniature video tab. I don't even know what the purpose of that is. So, okay, so let's continue.
Our pandemic over the entire time of really, and as you can see, we've had three
perfect.
waves. We are seeing noticeable decrease in new cases over the last 3 weeks that have continued. So we are now down to 700 cases, an average a day.
Okay, I don't want to make this video too long, so I don't want to, keep, but essentially everything's going down. Everything, these meaningless numbers, which so many people think are just bogus numbers, ridiculous numbers to look at and measure a pandemic by, all these numbers are going down. Hospitalizations, emergency department visits, inpatient admissions, all going down. Okay, so what we have here is we have Commissioner Overman, who doesn't ask a question. She just goes on a little bit of a rant where she correlates the decrease in positive cases and the decrease in hospitalizations with mandatory masking at county schools. You can't make this up. This is totally false. They're trying to tie in mandatory masks at schools for school-aged kids and the teachers that are exposed to the kids. They're trying to tie that in with the reduction of emergency department visits and positive cases. And we know it's false because we have the data on the age groups of the people that are testing positive. We have the data on the people that are going to the emergency department and that are going to the hospital, but it's very, very hard to get this data. The Department of Health in Hillsborough County won't just give it to you. And in general, it's very hard to get data in Florida and in the United States, period. So Commissioner Overman goes on that little rant, tying mandatory masking of schools into everything.
Case numbers coming down with the measures that our schools have taken.
See, and now Commissioner Smith, remember, who I said was extremely weak, this one right over here, she's praising Commissioner Overman for tying in the mandatory masking of schools somehow, just out of nowhere, just with no evidence, no nothing. It makes no sense. But they're such tyrants. They want mask mandates so much that they'll connect anything related to mask mandates that they can to this reduction, which occurred with no mask mandates on the public, in public businesses, or in any sort of public spaces. So now we have, there was a question that Commissioner Smith asked regarding home tests. She's like, well, maybe, is it the fact that people are starting to test more at home? Is that the reason why these numbers are going down? And then Dr. Holt proceeds to say that, well, no, actually, we incorporate home testing data into those numbers. And yeah, maybe we're not getting all of the home tests, but we do incorporate that data into the numbers that you saw earlier in the presentation. And then we have, they're just talking about the workload on ambulances and fire departments. And then we have Commissioner Kemp closing it off, talking about how she's seen reports in Tennessee and per capita this and that and the other thing, and just essentially ranting about things that she's read, posing no questions to the presenters, to the doctors. There was not. Now, contrast this with the past two meetings that we had here. Now, for this particular meeting, they don't ask about masks. They got answers that they didn't like in the past two meetings, and now this time they just totally don't ask about masks, and they attribute the decline of the data that they presented. They attribute, just out of nowhere, just based on nothing, they attribute this decline to more people using home tests and to the schools masking children mandatorily. And we do have a huge problem in Hillsborough County schools with kids being isolated and quarantined. We're probably up to, I wouldn't be surprised if we're up to 20,000 kids out of school. It's some ungodly number. So that's the summary of everything that's going on in Hillsborough County. That's the summary of the meeting that occurred today. And I'm going to end this whole video with a final clip from Jeff Dow with a Digital Soldier Network, who left a public comment in person. It's an incredible public comment, but that'll be at the end of the video. And now I want to fast forward to the next segment, which is the suppression of this right here, the horse dewormer, the suppression of, in particular, this study, which numerous doctors, let's see if we can, here we go. Numerous doctors wrote in 2021, it was published in August 2021, they wrote it because of the misinformation attacks that the media was launching, the suppression that the big tech was launching. Google even has specific protocols for how they deal with the mention of this medication. They will, and they openly state that they will suppress and remove search results that recommend it. So they really have a hard time in dealing, though, with a peer-reviewed, published paper written by doctors affiliated. Let's expand the affiliations here. We have Yale University School of Medicine. We have the U.S. Public Health Service. We have Texas A&M. We have an institute out of Japan. And we have an institute out of Australia. And a lot of people may not know how to read studies. So just to show you guys how to read studies, when you're looking on PubMed and you're searching through PubMed for keywords, what you'll see is, first and foremost, the abstract. To see anything more than the abstract, which is a basic summary of the full paper, you're going to have to go to the full text links. And right over here, PMC full text link, it's free, which is great, because a lot of these things are not free. You have to actually pay to get the full text link. We can go ahead and get the PDF right over here. There's a PDF button. And you can also see that one of the doctors has an MIT email address, so went to MIT. And you have the full study right here, written by these doctors who wanted to highlight the facts regarding this medication right here. So how does Facebook suppress this? How do they censor it? So here's what they did. They put a notification that the information that I posted, which was no commentary, really, it was just a summary of what this was, which is a paper on this medication written by certain doctors, and it links to this lead stories article right over here, okay? So let's go to this lead stories article. So there's something about a Yale professor. There's something about the ivermectin, one of the ivermectin manufacturers, and there's actually nothing about the main contradicting point in the title, but that's okay. We can go, let's see here. Oh, what happened? Did they take it out? Okay, now, here we go. A study that proved that the medication works against COVID-19 was retracted a month later, discredited by fraud. First of all, that statement is a total misrepresentation of what happened, but before we even go there, the study that this article is talking about was written by a pharmacist, a PhD in pharmacology and pharmacy, and his colleagues out of the University of Liverpool. So none of the doctors in this study have anything to do, you can see right here in the affiliations, with the University of Liverpool. None of these doctors are pharmacists. So they're falsely tying this study with this not retracted, like they're saying, but revised study that was written by individuals affiliated with the University of Liverpool. So I just want to inform everybody that this is going to be the strategy to suppress this study that was written to counter suppression. These doctors all got together. They're not getting paid for this. There's no sort of a benefit for them to write this other than to oppose the fake information and the false narratives that have been going around about this medication. And this study is an incredible read. I would encourage everybody to just read the full study. It's not even that long. Starts off with the introduction, and introductions usually just provide you with details outlining the main article. And then you get into the methods. And this is a literature review, so they explain the literature that they reviewed. And so they go into all the literature that they reviewed. And then they go into a conclusion, the conclusion that they're coming to after reviewing the literature. So this is a great study. It's a very short study. I encourage everybody to read the actual full version. So let's move on from that to this. Breaking news, you might say. I got a text from someone that alerted me to this, that the Eastern Virginia Medical School has deleted their COVID-19 management protocol. So anytime I wanted to pull this up, I would just search EVMS COVID protocol right here on the internet. It would pull up this PDF, which you would go ahead and click on. So we click on it, and file not found. The Eastern Virginia Medical School deleted it. Now, why would they do that? Who are the people running the Eastern Virginia Medical School? How did all this even come about? So luckily I saved the file. I have it right over here, the latest, because this has been updated a few different times. So I've got the latest EVMS COVID-19 management protocol. Now, I don't know if they've totally moved away from this whole entire protocol after over a year and a half of successful implementation of a low fatality treatment protocol. But all it takes is one good man. That's it. And this one good man in this case is Dr. Paul Merrick, the chief of pulmonary and critical care medicine at the Eastern Virginia Medical School. He's the one that spearheaded all of this. He's the one that developed this protocol. And so let's just look into EVMS real quick. We see two links right here. The short URL, like, all right, so that's the short URL for COVID care. So let's go ahead and open this in a new tab. Okay. So let's see here. Responding with safety and well-being of campus and community. Okay. COVID-19 guidance. Okay. So where would we go? Where would we go for this protocol? Well, let's see. Faculty and staff. We might try the FAQ. We might try patient care. That's really what this is. That protocol, the EVMS protocol, is about patient care. What sort of patient care to give depending on the disease state. So we go to patient care, and here we're confronted with, first of all, a message about vaccines. So we have a message here that is essentially pushing vaccines. Okay, and then now we have COVID-19 guidance right here. And it essentially says, let us know if you have any of the following, if you're making an appointment: a respiratory illness with fever, close contact with someone who is now sick. I can't find anywhere where they have the PDF, the COVID-19 critical care management protocol developed by Dr. Paul Merrick. I can't see where they have it anywhere on their website. And I just want to show everyone how thorough this is. And of course, I've said before, vitamin C is what's most prominently featured in this protocol. Starts off with the prophylactic protocol, and then we go to symptomatic patients at home protocol. Then we go to a little sheet on the prophylactic protocol. Then we go to mildly symptomatic patients on floor or ward in the hospital. Okay. And then we go to what happens when you admit to the ICU. We go to this protocol here, the essential treatment, and then we have the additional treatment components. And then we go over here to a table that looks at differences in mortality rate based on the usage of corticosteroids, it looks like. Then we go here, we've got the horse dewormer, as everyone calls it, and clinical studies looking at that. Let's see here. Treatment of macrophage activating syndrome. Okay, we've got some charts. Then we've got a post-ICU management protocol. We've got a post-hospital discharge management protocol. This is a very thorough protocol. Even some guidance for maintaining mental health. Let's see what we have here. Key concepts of the EVMS protocol. I mean, this is just so extremely thorough, and it's a 39-page document, and it's been totally deleted by the Eastern Virginia Medical School. And I think that this matter deserves some attention, so I'm just letting everyone know how political this has become when an ultra-low fatality rate protocol like this has been deleted by the establishment where the doctor who developed it works at. It was deleted by that establishment. So EVMS has essentially erased their affiliation from this protocol. And that's just very disturbing, especially given how successful it has been and the low fatality rate that's associated with it. So Eastern Virginia Medical School protocol deleted. And now let's go ahead and move on to the United Kingdom, the dire situation that the United Kingdom is in. And why should we care about the United Kingdom living in America? It's because the UK provides absolutely outstanding, thorough, broken down data, and we don't. So we can't look at this data for our own country, even for our own state of Florida. We can't look at this data. But the UK is generous enough to supply bi-weekly reports that are called technical briefings. So all I did in the search engine was type United Kingdom technical briefing COVID. First result right over here, just click on it. And we have a list of documents, okay? Technical briefing 23, technical briefing 22. These are bi-weekly reports. Technical briefing 21. So what I want to do is compare technical briefing 19. Let's say this, go back to technical briefing 19 to 23. So that's 8 weeks. 8 weeks. What's the difference in the numbers and in the data between the most recent report and 8 weeks ago? So we just click here. We start on technical briefing 19. And I just know off the top of my head, if you want, you can go ahead and scan through this whole report over 50 pages. But I want to get to table 5. Table 5, great data on table 5. So where is this table 2? Table 5. And so what I've done is I've taken table 5, and what table 5 shows is the attendance to emergency care and deaths by vaccination status among Delta cases in England from these dates. So the numbers really that I'm most interested in are deaths within 28 days of positive specimen date. So they test positive for COVID-19. Let's look at the 28-day period after they've tested positive. How many of those people have died? Okay. So I have this page right here, which contains table 5 from technical briefing 19 and table 5 from technical briefing 23. And let's go ahead and take a look at this data. Got this thing kind of covering up. There we go. Okay. So first of all, why don't we take a look at Delta cases, period, all cases. Forget the age range less than 50, over 50. All cases in technical briefing 19 is 229,218. All cases in technical briefing 23 is 593,572. And so this is looking at the beginning February 2021 to the end date September 12th, 2021, which, yeah, not a huge fan of that design, but whatever. You would think that as time goes on with the deployment of the vaccines and as more and more and more people in England are getting vaccinated, according to what we hear and according to what the vaccine supremacists believe, they're actually more protected. As the population gets more and more vaccinated, you're going to have less and less people going into the hospital, having severe reactions to COVID-19, and less deaths. Because at first they said, look, the vaccine, it doesn't really protect you from getting it, but it does protect you from developing a severe illness and from death. That's what they say in America. Okay, so in the UK, is that the case now? In a place where we have this detailed broken down data that we can't get easily in America, and especially from Florida, is that the case in the UK? So we know it's certainly not the case with positive numbers. So we know that after 2 months of intense vaccination, and we have all that extra time, by the way, that people were already vaccinated and should be fully immune. So after this 2-month period, we have over doubling of cases from 229,218 to 593,572. Okay, so let's see here. Well, we can look at everything. I honestly didn't look at these particular rows. Cases with an emergency care visit. So we went from 7,790 to 22,162. The numbers are just insane. Let's just fast forward to deaths here. Okay, so deaths in technical briefing 19, which contained data up to July 19th of 2021, we have all cases of death. We have 490 in the total column. So 490 total cases of death in technical briefing 19. In technical briefing 23, we have 2,542 cases of death in the total column occurring within 28 days of a positive COVID-19 test. That is an increase. That is 5.5 times more than 460. This increase in positive Delta cases is about a 2.5 X increase. So deaths have increased actually at a significantly higher rate. And there has been an absolute increase from 460 to 2,542. And then if we move over here and we look at these particular columns, which show the number of deaths after one dose, after more than 21 days after one dose, after more than 14 days after 2 doses, and unvaccinated. So let's go back here to the death rows, and on the all cases row, we have a total of 224 who have died after receiving 2 doses. 224. In technical briefing 23, we have a total of over 1,600 people who have died after receiving 2 doses of the vaccine. This increase is dramatically higher than the increase in unvaccinated people who have died, which goes from 165 to 722. And in both cases, you go to technical briefing 19, go to technical briefing 23, the number of people who have received 2 doses and have died has always outweighed the number of the unvaccinated. And it's the exact same here, where we have 1,613 who were vaccinated and vaccinated with 2 doses for more than 14 days, compared to just 722, which is less than half of the unvaccinated population, the unvaccinated group rather, that have died. of COVID-19 Delta variant. So there is an incredible situation occurring in the United Kingdom. And the only reason we can't really say the same about the United States and about Florida is because we don't get this type of data. We don't get reports that are over 50 pages long and that are broken up like this. So unless you believe that people in the United Kingdom are made of something different, that we're just some sort of a different type of human being, then this data also applies to us. We're all human here. It also applies to us. And I want to go ahead and move on to this paper, which is in preprint. It has not been peer reviewed. Don't know what just happened. Has not been peer reviewed. It is looking at data out of Israel. So even though it has not been peer reviewed, the article is open to comments, and there's a lot of academically minded individuals who are commenting. There's a lot of discussions that are taking place in the comments, but in short, no one's been able to find any sort of severe problem with this paper, but it is still pending peer review, and to my knowledge has not been published yet. But let's see here. Reports of waning vaccine-induced immunity against COVID-19 have begun to surface. With that, the comparable long-term protection conferred by previous infection with SARS-CoV-2 remains unclear. So what they're doing is they want to see how protected someone is after they've recovered from the coronavirus compared with how protected someone is who's just been vaccinated against the coronavirus. COVID-19. So we conducted a retrospective observational study comparing 3 groups. The first group are SARS-CoV-2 naive individuals who received a 2-dose regimen of the Pfizer vaccine. And so what that means is these are individuals who did not get sick with COVID-19 who received the vaccine. Then we have previously infected individuals who have not been vaccinated. Then we have previously infected individuals who were vaccinated with a single dose. Those are the 3 groups in this study. Okay, so the results. SARS-CoV-2 naive vaccinees, so people who didn't catch the coronavirus but who were vaccinated, had a 13.06-fold increased risk for breakthrough infection with the Delta variant compared to those previously infected. So what this is showing is that the individuals who were just vaccinated are substantially at higher risk of getting the Delta variant than those who haven't been vaccinated and who got sick and recovered. So the increased risk was significant for symptomatic disease as well. So they're not just talking about a positive test result, they're talking about symptomatic disease as well. Let's see here. When allowing the infection to occur anytime before vaccination, evidence of waning natural immunity was demonstrated through SARS-CoV-2 naive vaccinees. So SARS-CoV-2 naive vaccinees had a 5.96-fold increased risk for breakthrough infection and 7.13-fold increased risk for symptomatic disease. They were 7 times more likely to have symptoms and illness from COVID-19. SARS-CoV-2 naive vaccinees were also at greater risk for hospitalization. So people who didn't get COVID-19, who didn't get sick from it, but got the vaccine, were at greater risk for hospitalization compared to those who were previously infected. Okay, let's see here. This study demonstrates that natural immunity confers longer lasting and stronger protection against infection, against symptomatic disease, and against hospitalization caused by the Delta variant compared to the Pfizer 2-dose vaccine induced immunity. Individuals who were both previously infected with SARS-CoV-2 and given a single dose gained additional protection against the Delta variant. Okay, so that's very interesting, and totally contradicts a lot of what the vaccine supremacists believe. Of course, vaccine supremacists are totally ignorant, low information people. They don't know anything about this study. And when you try to talk to them and you try to talk about actual scientific findings, actual data. They don't know what to say. I'm sure everyone's tried to have a conversation with them, and it's very difficult. So let's see what we have here. Okay. All right. So we've reached the end of the video. I want to leave off with this public comment from Jeff Dow, who's with the Digital Soldier Network. I believe it's digitalsoldiernetwork.com. He has a podcast. It's a great podcast. He does it daily, and it's phenomenal. And he made his way all the way to downtown Tampa so that he could speak publicly. He endured wearing a mask because he had no choice. They gave him literally no choice. If he wants to face the commission in person, he has to wear a mask, and he did. And this was his public comment.
Morning, board.
Oops.
I'm sick of coming up here. I'm pretty sure you guys are probably sick of hearing me as well. There's something more important right now, ma'am? Just curious. I noticed when the other gentleman spoke, he had full attention. I just want to make sure I had it as well. Thank you. I've read you guys the Florida Constitution. I have gone through it explicitly, Article 1, Section 1 to, I've done a number of them, probably 4 or 5 different as well. I'm curious, can anybody at this board please tell me which authority is giving you the ability to mandate a mask within this building or any other in this city? Let the record show, no answers. You know it's unlawful. It's gone to court. District Court of Appeals has actually found mask mandates to be unlawful. Apparently talking is not doing enough, and it appears that lawsuits are going to end up having to go down that path for you infringing ma'am. Commissioner Kemp.
Excuse me, you shouldn't be calling out individual commissioners.
I'm just making sure you're paying attention since this is.
And just to pause, Jeff's incredible, amazing public comment. It is illegal for them to say that, to try to intimidate you into not specifically referring to individual commissioners. There's nothing wrong with identifying a specific commissioner, especially like Jeff said, someone who's just completely being disrespectful and ignoring him. Nothing wrong at all. And to try to intimidate him and others from not identifying specific commissioners is totally illegal.
Public comment time. Thank you. I know some of you have further aspirations for mayor and further going on to other offices within Congress. I'm pretty sure that these public comments are going to continue to come up. I'm pretty sure that if lawsuits, actually, I believe there's a couple of them already in the place, go forward, that's going to make your opportunities running for mayor, running for Congress, or any other body that you should choose to run for awfully hard. We're building up coalitions behind the scenes right now to constantly track this stuff and share this information out to the public. I ask you to do the right thing. I will continue to come down here to speak on behalf of the people who work in this building and other buildings who do not want to have to wear a mask because there have not been any verifiable proof that masks are even effective. I thank you for your time, and I hope that I don't have to keep coming down here. Please do the right thing. Unmask your people. Thank you.
Wow. That was just absolutely incredible. Jeff Dow, that public comment was totally amazing. And he's so cool for going down there and taking the time out of his day. He works tirelessly on trying to reform our local government, and from the school district to the county commission to the city council, just trying to keep track of everything. So Jeff Dow, digitalsoldiernetwork.com. And yeah, that is going to be the end of my video. So I hope there was some insightful information out there for people. I hope everyone got something out of this. And I guess I will see everyone next time. Thank you guys so much for tuning in.